Hello, my name is Ashley Cutler, and the title of my DNP scholarly project is Improving Nurses' Attitudes Towards Substance Use Disorder, Screening, Brief Intervention, and Referral to Treatment, or SBIRT. Substance use disorder, or SUD, is a major public health concern in the United States, affecting over 19 million Americans. And despite multiple treatment options, only 1 in 5 patients with SUD will seek treatment. Patients with SUD encounter many barriers to accessing healthcare, including negative attitudes of nurses, and these negative attitudes are thought to be driven by a lack of SUD education. Therefore, using Pepla's theory of interpersonal relations with a focus on the nurse-patient relationship, this project was aimed to improve the attitudes of nurses towards patients with SUD through an educational intervention on SBIRT. Specific aims of the project were to explore baseline attitudes of nurses towards patients with SUD, to explore differences in baseline attitudes in relation to clinical practice setting, prior formal education on SUD, and family history of SUD, and to evaluate whether SBIRT education influenced nurses' attitudes towards patients with SUD. Attitudes were measured using the 20-item 5-subscale Drug and Drug Problems Perception Questionnaire, which is a valid and reliable tool used to measure attitudes of healthcare workers towards patients who use drugs. Higher scores denote negative attitudes, where lower scores denote more positive attitudes. So the result of this project showed that statistically significant improvements were seen in mean attitude scores for not only the DDPPQ tool as a whole, but within all 5 subscales. And as you can see in the pie chart, most nurses reported not having prior education on SUD, with nurses who did have prior education reporting improved baseline attitude scores. Prior education was found to be a predictor of baseline attitude scores. So what does this mean? That SBIRT training improves attitudes, and improved attitudes decrease barriers for patients who wish to seek help. Effective screening can identify patients not only with SUD, but also at risk. And teaching nurses brief intervention gives nurses the tools necessary to talk to patients about substance use misuse and promote change in the direction of health. The creation of the Lifespan Addiction Treatment Brochure for this project served as a referral to treatment for nurses. This provides patients with local community resources and empowers nurses to help these patients with continuity of care and follow-up. Practice implications. Prior education is a predictor of baseline attitudes. This reinforces the need for educational interventions, such as SBIRT training, not only with undergraduates, but with licensed nurses. And implementing systems-wide SBIRT will train all healthcare professionals to effectively screen, to have conversations with patients, and to refer as appropriate. Cost savings. Cost savings include up to $5.10 for every $1 spent. Additionally, training providers can generate revenue through coding. So screen, intervene, and have them seen. Please scan the QR code for references. Acknowledgements. Thank you, the Theta Kappa Research Committee, for funding this project. Dr. Ann Mitchell, who provided the SBIRT curriculum. Dr. Maria Ducharme, the clinical site mentor. Dr. Kara Misto, the clinical site nursing researcher. Dr. Shannon Avery Damaris, the faculty chair, and Dr. Kathleen Elliott, the DNP project committee member and personal mentor. The addiction treatment brochure that was created and has now been adapted and implemented at the organization is here for you to view. Thank you.